Are you self-conscious about the size of your areolas or nipples? Maybe worrying that they're too big or misshapen? Here at Austin-Weston, our surgeons can give you the look you want with usually minimal scarring and minimum risk of altering sensation. Here's Dr. Byron Poindexter to explain your options.
Most people are concerned with the areolas being too big. We can reduce the size of the areola, but the trade-off is a scar, generally one that just goes around the areola. That has a lot of different names. One that's pretty common, a donut mastopexy. Others would call it a circumareolar mastopexy just because it goes all the way around the areola. Classic measurements would tell us around 4 centimeters, maybe a little bit under 2 inches, is actually a pretty good size and a fairly attractive size for the areola. So when we're making our decisions, we use something close to that for most of our judgment. A lot of our patients are having the circumareolar or donut mastopexy at the same time as a breast augmentation. It adds a little bit of extra time and a little bit of extra cost. Maybe 30 minutes in the length of the procedure, but it's probably another $1,000, not more than $1,500 or $2,000, I would think, to the actual procedure itself to combine it at the same time. The scarring from the reduction of the size of the areola is typically just around the edge of the areola where the dark skin meets the light skin. Typically, that's a thin scar that's lighter in color than your skin when all is said and done. Most people are very happy with it, don't have an issue with it. It's one that can be improved with a few different things if it's necessary in the future, including the possibility of tattooing. The procedure that I do to reduce the size of the nipple is one that actually reduces it down at its base, right where it meets the breast or the chest skin. That way there's no scar right on top. We take out a little ring of tissue around the bottom, like a little piece of calamari, and then that helps us to shrink it down in height. And I take out some little darts of skin around the edges, little triangles, and pull that together, and that makes it not as big around. So you combine those two different types of things and we get one that's shorter and more narrow. We're not removing nipple and we're not removing areola, we're taking away some of the skin that's around it to help everything be smaller. The nerves come in from behind, so from that operation alone, chances of changing or losing sensation are extremely small. Are they possible? Yes, but really unlikely. If you've had children and you could breastfeed, chances are you're going to be able to after just this type of lift, as long as there's no change in the sensation. If there is a change in sensation, which we've said is pretty unlikely, that can affect the ability for breastfeeding just because the signals between the brain and the breast kind of get crossed up. The type of areola reduction that we've been talking about today is also discussed as a type of breast lift. What we need to be really clear about is that it really will just lift the areola. It's not lifting the breast. So this is something good for areola reduction or putting it a little bit higher on the breast, but this is not an operation that's going to lift the whole breast up. So if that's something you're looking for, we're going to have to look at other options to help you out.
Click the link in the description below to read our blog post on this subject. You can also schedule a consultation with one of our specialists through our online form or browse the before and after galleries to see our patients' amazing results.